So this commenter has a really good point. Fat necrosis can masquerade as an infection, and it can be challenging to tell the difference between the two for someone who's not experienced. When you have areas of fat necrosis, your body doesn't like that, and you tend to get a lot of inflammation around that area, and it frequently turns red over top, so it can certainly look like an infection. And if it's big areas, some people have pain and swelling, and it really looks like you may have an infection. So here's the things that you can do to try to figure out, is it an area of fat necrosis or is it really an infection? So usually these areas on physical exam look and feel pretty similarly, infection versus fat grafting. It's swollen, it's red, and if you feel it, you can feel that there's a fluid collection underneath. So if you can get to it before it comes through the skin and you have drainage, you can send a sample that's taken sterilely to try to determine if there's an infection in that fluid or not. So sending that fluid to look for bacteria is a way that it'll give you a hint to whether this is an infection or this is just truly fat necrosis. Now, the other thing that can help you figure out what's going on is to look at the fluid itself when you get a sample. So fluid that is infected will develop pus, and a pus has a very characteristic look. Most of us are familiar with that. It's whitish, yellowish, greenish color. The texture is a very characteristic thing. Most of us have seen it at some point in our life. Now, fat necrosis can be similar, but there's some distinct differences. So it certainly can be yellow, but it tends to be more yellow and less white and green, if that makes sense. It's a little thinner in texture, and you also will see little tiny chunks of something yellow with some clear fluid that's a yellowish color in between. So they do have some distinct differences. Often it can be scary and look like pus, especially if you've not seen it before, but your plastic surgeon will be able to tell the difference when they look at it. Now, the next thing you can see is if it does come through the skin, which can happen with both of these problems, unfortunately, is if it's fat necrosis, the first thing you often see is just some clearish yellow fluid. And if it's an infection, you often see pus as the first thing that drains. And then, of course, I want to throw out that the treatment for these two problems is actually similar. So if you have an area of fat necrosis that's bad enough to be causing drainage through the skin or an infection, that needs to be drained. And so if that happens, then your surgeon will examine you and then figure out, depending on what else is going on, whether you can be drained at bedside or you need to go to the operating room. Because once there's an opening, it's always a good idea to remove a collection of fat that didn't make it so it doesn't become infected. And then if you have an infection, of course, we want to remove that fluid as well. So yes, as you said, it can be difficult to wrap your head around because they're two very different problems, but they have very similar presentation. So I'm sorry you went through this. I hope your surgeon's taking good care of you. Let me know if you have any questions about fat necrosis and how to manage this problem.